save lives and protect people from this pandemic. I want to thank our healthcare workers who've dealt with the challenges of keeping the vaccine program going, despite the many delays in supply and setbacks that we've caused because of unpredictability of when we were getting new doses. Your work, the work of our frontline workers, has kept on going even in times of uncertainty. Alberta has consistently led the country in vaccination rates, and much of that has to do with your efficient and dedicated efforts. So thank you. Last month, we were ramping up our vaccine rollout when suddenly we started seeing our shipments begin to be cut time and again. We hoped we'd be much further ahead with our efforts to vaccinate Albertans by now, of course. But we know that we know for sure the demand is there, and our plan, developed by our COVID-19 vaccination task force with input from scientific experts, has proved that it works. But the lack of vaccine supply has held us back. But with more vaccine doses starting to trickle in, and finally some clarity from the federal government on how many shipments will arrive and when, we're now ready to expand vaccinations to all seniors aged 75 years of age and older throughout Alberta as we move into Phase 1B of our vaccination program. Starting today, February 19th, Alberta Health Services will offer the vaccine directly to all residents in retirement centres, lodges, supportive living, and other congregate living facilities with residents who are 75 or older. And starting Wednesday, that's February 24th, any Albertan living in the community who was born in 1946 or earlier will be eligible to book an appointment for a COVID-19 vaccine. Appointment availability will be based on vaccine supply, of course. Seniors will be able to book their immunization appointment through AHS using an online and telephone booking system. A link to the online booking tool and telephone number will be posted on alberta.ca and on the Alberta Health Services website, and we will send out a reminder next week with those details. This is an exciting day for Alberta seniors, and I hope it offers a real sense of relief for the thousands of family members and friends who love and support them. So I'm also very happy to announce today that we have completed all second doses for residents in Alberta's long-term care and designated supportive living facilities. More than 29,233 residents across the province have now received 2 doses of vaccine. This represents all eligible residents at these facilities, except those too sick or otherwise unable to receive both doses. This important milestone means that thousands of Albertans can count on their loved ones being fully protected against COVID-19. These residents of long-term care and DSL centres are among the most vulnerable, of course, in our society, and we're committed to protecting them. As you know, about 2/3 of deaths from COVID-19 in Alberta have occurred in those settings, and we are very happy to see that since the vaccines began in long-term care centres, that the number of infections, of outbreaks, of hospitalizations, and of fatalities coming from long-term care has fallen dramatically. That is very good news. In addition to expanding vaccinations to all seniors aged 75 and older, I'm also pleased to announce the details for Phase 2 of Alberta's vaccine rollout. We remain focused on protecting the most vulnerable Albertans, protecting our healthcare system, and, of course, preventing outbreaks. Our vaccination rollout has always been focused on ensuring that Albertans who are most at risk of serious outcomes from COVID are protected first. So Phase 2 will roll out in 4 groups, covering 1.8 million Albertans. We expect to begin Phase 2 vaccinations in April, but this is, of course, dependent on how much supply and how many doses we get out of Ottawa. The following groups of Albertans will be eligible in Group A of Phase 2. Those will be Albertans aged 65 to 74, and First Nations and Métis people aged 50 to 64 on or off reserve or Métis settlements, as well as staff and residents of licensed supportive living who did not get vaccinated in Phase 1. And let me pause in case anybody's wondering why we have a slightly different age category for Indigenous and Métis Albertans, and the reason is that, unfortunately, that population of Indigenous Albertans has had much worse health outcomes than the broader population, much lower average age of hospitalizations, and typically more serious consequences from COVID infections. And so we are following the scientific advice to address a younger age cohort amongst Albertans from Indigenous backgrounds. Group B will include Albertans aged 18 to 64 years of age who have underlying health conditions which we know can make COVID-19 infections more deadly. Our health officials are currently working to define exactly which underlying conditions this will apply and in what priority, and that we will announce those conditions and priorities prior to Group B vaccinations starting. So Group C will cover all residents and staff of congregate living settings, including correctional facilities, homeless shelters, group homes for disabilities, mental health, and other types of licensed supportive living. Group C will also include healthcare workers and caregivers who are providing care for individuals who are at high risk of serious outcomes should they contract COVID. Finally, Group D will see all Albertans between the ages of 50 and 64, and all First Nations and Métis people between ages of 35 and 49 on and off reserve and Métis settlements will be eligible for vaccinations at that stage. I know that there are some folks who will be disappointed to hear that they must wait until phase 3 before they're eligible for vaccination. And workers who must interact with people every day because of their jobs, like teachers, transit workers, and those hardworking Albertans who've kept our essential services like grocery stores open since day one of this pandemic, well, they might wonder why these are not in phase 2. I understand that question, and I know that everyone wants to return to normal and be safe, and be protected from the virus. But with a limited amount of vaccines, we must make difficult choices to ensure that those people who are most at risk are protected first, following the data and the scientific advice. We've lived with this pandemic for nearly a year, and in that time, we've learned some critical lessons. We know, for example, that COVID-19 can present a serious health challenge to anyone who gets infected, but we also know that our seniors and those people who have serious health challenges, comorbidities, chronic conditions of certain kinds, are especially vulnerable to adverse outcomes from this disease. So we have to ensure that those people who are the most at risk of severe health outcomes get the vaccine as quick as we can get it to them. This is the same motivation that informed phase 1 of the vaccine rollout, that is to say, protecting the most vulnerable. So please know that we'll get the vaccines to you as quickly as we can, just as quick as we get supply. Our plan has the ability to ramp up the number of vaccinations done per week, and we are shooting for up to over 200,000 a week before the end of March. In fact, we have a stretch target that's considerably higher than that as we bring on community partners through the pharmacies, and we set up a large vaccination depots and centers around the province. We hope to continue leading the country in the pace of vaccination. As I said before, our vaccination rate has consistently been one of the fastest in the country, and once we get going, we will, in the true Alberta fashion, get her done. So thank you, and I will now invite Minister Shandro to follow up with further details of phase 2 rollout.
Thank you very much, Premier, and good afternoon, everyone. Very happy to come and supplement what Premier just announced. And I want to first add my appreciation to the vaccination staff, the folks in the ministry and AHS officials, as well as our vaccine task force, who have put so much time and so much effort into our vaccination program. Now, those who are working on the vaccination distribution in Alberta not only made our plan work, they made it and developed it into one of the best in the country, despite the challenges that we encountered on the way. We're not at the finish line yet, but we are on the way. And today I'm pleased to share more details of our Phase 2 vaccination rollout. And the sequencing was based on recommendations from, as I said yesterday in yesterday's announcement, based on recommendations from officials at the ministry in consultation with our federal counterparts. And in looking at Alberta's own COVID data, we know that the age of a patient is the most important predictor of severe outcomes from COVID-19. And this includes hospitalization, it includes ICU admission, and even death. Now, following that, we know that many existing health conditions, such as diabetes, heart issues, kidney disease, also play a major role in whether or not there are severe outcomes from COVID for a patient here in Alberta. And our decisions are data-based. They are informed by the recommendations from the National Advisory Committee on Immunization, as I mentioned yesterday, and in line with other provinces. And we will proceed by offering vaccinations to 4 key groups in the following order. The Group A would include Albertans who are aged 65 to 74 years, and for folks who are First Nations and Métis, ages 50 to 64 on or off reserve and Métis settlements, as well as any staff and residents of licensed supportive living not already covered in Phase 1. Now, this is aimed at reaching everyone living and working in long-term and designated supportive living in Alberta, as well as continuing our age-based eligibility for vaccinations here in Alberta. Data also shows us that Indigenous adults are more likely to have pre-existing chronic conditions, and should they become infected with COVID, a higher likelihood, as Premier said, of severe outcomes. And we've always said that we will protect the most vulnerable Albertans first in our vaccination plan. And this is reflected in the lower age cutoff for those Indigenous people in Alberta. Now, Group B would include Albertans ages 18 to 64 with underlying health conditions. The underlying health conditions will be determined based on extensive analysis of data and published literature to identify the conditions that put people at highest risk of severe outcomes from COVID. Those specific conditions will be communicated prior to the start of Phase 2B. Now, Group C for Phase 2 will include residents and staff of congregate living settings, and that would include correctional facilities, homeless shelters, group homes, including disability, mental health, and other types of licensed supportive living. Group C will also include healthcare workers and caregivers that are providing direct patient care with a high potential for spread to folks who are at risk. And some might question why we are targeting individuals in correctional facilities and homeless shelters. To us, it's simple. Albertans that live in congregate settings are at an increased risk of exposure and can easily and quickly transmit the virus within a large group and are more likely to have health conditions that could lead to severe outcomes from COVID-19. In this sense, correctional facilities and homeless shelters are no different than any other congregate living arrangements, and we have already seen ample evidence of how COVID can spread through those facilities very rapidly. Now, next is Group D, and Group D will start to see the general population of Alberta become eligible for vaccination, starting with those folks who are ages 50 to 64. Vaccinations will be offered first to the oldest cohort of this group, starting with those who are between 60 and 64, and then it will move to vaccinate 55 to 59-year-olds and 50 to 54-year-olds. Now, Group D will also include First Nation and Métis people ages 35 to 49 on or off reserve and Métis settlements. We know that there are questions about when vaccine will be made available to other frontline service providers, those whose work requires them to be in contact with others. If additional vaccines are licensed for use in Canada and made available to us here in Alberta this spring, we will be able to consider adding additional groups to the Phase 2 rollout. Now, around the world, Israel has been recognized as a leader for their successful vaccination campaign. And earlier this month, Ontario's COVID advisory group, Science Table, put out a report summarizing the lessons learned from Israel's immunization strategy and how they could benefit other jurisdictions. A critical factor in Israel's success was simple prioritization and vaccinating people as fast as possible to reduce serious outcomes and death. And since age is the single greatest factor for risk for COVID mortality, it was the only determining factor in their prioritization, with the exception of healthcare workers and first responders. Now, having already vaccinated a large percentage of folks who are over the age of 60, they're already seeing positive results of this strategy. And this should give us in Alberta great hope, as our prioritization is also largely determined by age. Now, from the beginning, we have had a plan in place that would work for Alberta. But dealing with a sputtering supply of vaccines has led to frustrating starts and stops in our own plan. The more vaccine that arrives in Alberta, the faster we can get to phase 2 and begin immunizing many, many more Albertans. The pandemic is not over, but we will steadily build up our defenses against it. But until everyone has a chance to get vaccinated, please continue to stay the course. Please continue to abide by the public health restrictions. Thank you very much.
Great. Thank you, gentlemen. Premier Kenney and Minister Shandro will now be taking some questions. Just a reminder to everyone online to keep your remarks brief and limit yourself to one question. So with that said, operator, can you please put through the first question?
James Keller, Globe and Mail.
Hi there. This is a question for the Premier. Yesterday, the Health Minister said that it looks like it's going to be safe to move to the next, move forward with the reopening plan. I'm wondering, given the increasing concern about the variants and the fact that infections are now increasing outside of Calgary and Edmonton and the other health regions, where does that comfort come from, and what risks do you see in moving ahead, just sort of given some of those warning signs?
So, James, we haven't made any final decisions about that. As we said in outlining the path forward, we'll take at least 3 weeks between each step forward of reopening so that we can carefully assess the data and trends. And if we see a troublesome increase in infections and hospitalizations, the positivity rate, the RT rate, then we would reconsider, possibly delay future openings. And if things were to get really bad, and let's say we end up with a huge spike in new cases and hospitalizations driven by the more contagious variants, I've been clear that we might have to introduce additional measures that limit social interaction. So as I say, we haven't made any decisions. We just went to step 1 of the path forward about 10 days ago. Our cabinet will be meeting, Cabinet COVID Committee will be meeting late next week to make an assessment, to look at the data as it then is, and to take the advice of our Chief Medical Officer before making decisions. So this is a very gradual, careful, and prudent step forward, a path forward, I should say. It allows us to go at the right pace. We think it is important that we show Albertans that there is a sign of hope if we continue to do what's necessary to limit spread and to protect our hospitals, that we can continue to benefit from more social and economic activity. And in that context, it's important to remind people that we are not and never have been in a lockdown in this province. The Ministry of Jobs, Economy and Innovation estimates that over 99% of Alberta businesses are able to operate right now within safe guidelines. So we'll continue to take a gradual and prudent approach.
Thank you. Operator, would you please put through the next question?
Julia Wong, Global News.
Hi, this question is for the Premier and Minister Shandro. I do appreciate that a lot of details have been released today, but when will the full plan be released to Albertans? And what do you say to Albertans who don't fall into any of these categories?
Well, I'll refer the first question, Julia, to Tyler. On your second question, I would say that we'd love to have everybody vaccinated already, like Israel has done virtually, but the federal government didn't get us the supply. And that is why we're working with other provinces for a plan B to access potential domestic vaccine production so we can get more doses and get more jabs in people's arms just as quick as we can. The most important thing, though, is that we inoculate the people most vulnerable. And as I've mentioned, we've already seen a very encouraging decline in the number of infections and outbreaks coming out of our long-term care centers as a result primarily of just the first dose that was administered. Let me just put out another little hopeful sign here. Gosh knows we need some hope. There was a really encouraging study out of Israel yesterday indicating that the first dose of the Pfizer vaccine appears to be about 85% effective at preventing serious COVID symptoms about 3 to 4 weeks after administration, which I think validates the decision we made shortly after Christmas to go long on the first doses. Even that meant we ended up delaying administration of the second doses, but it may have helped to get us that critical coverage in those long-term care centers where 2/3 of our deaths have occurred. In terms of when you can expect more details, I'll refer that to Minister Shandro.
Thanks, Julia. And first, I just want to highlight that this question gets to the heart of how big of a deal this announcement is today. That this is an announcement that includes about 1.8 million Albertans. And so by the end of phase 2, we would see over 2 million Albertans being given the opportunity to have a vaccine. So this is a big deal. And what that means, months ahead of these vaccines for phase 2 being able to even be provided to Albertans, we've made this announcement, but with the careful and thoughtful advice that we are receiving from the National Advisory Committee on immunization, as well as our own advisory committee here in Alberta on vaccines. And when we get to the end of phase 2, whether there's even going to be need for prioritization in phase 3 is quite frankly going to be up to the federal government. What other vaccines are going to be allowed to have approval for use in Canada? What are the purchase agreements that Canada has with those manufacturers? And what is the delivery schedule that's going to be included for those vaccines so that perhaps, depending on what the federal government is planning on providing for Albertans later on, when we get to the end of phase 2, when we see what we have available to us in the allotment tables for phase 3, perhaps we don't even need prioritization groups, but that's in the hands of the federal government right now, and we'll have to wait and see as we get closer to those dates.
Just going to add something, Minister.
Oh, sorry, I misunderstood.
Yeah, I just wanted to add something to Tyler's last point, which is one of the reasons we can't outline the phases 3 and 4 at this point is really it's so contingent on supply and what kind of vaccines. They may have different storage requirements, different logistical complexity. They may be more or less effective on different age groups. So there are just too many unknowns for us to put out a reliable prioritization list for the final phases of inoculation. I'll give you one example. I mentioned this earlier in the week, but there is some evidence that the AstraZeneca vaccine developed by Oxford University may not be sufficiently effective for people over the age of 65. Well, we are anticipating Health Canada approval of AstraZeneca's vaccine I was told by the Prime Minister yesterday, in the fairly near future. Canada's made orders, so let's say that we suddenly, and it would be a good problem to have, let's say we suddenly get hundreds of thousands of doses of Oxford AstraZeneca in April. Well, but we might get advice from the scientific experts not to administer it to people over the age of 65. That suddenly means we go into a younger cohort faster. So those are the kinds of unknowns that make it difficult for us to set in stone the plans for phases 3 and 4.
Thank you. Operator, would you please put through the next question?
Jeremy Thompson, CTV.
Hi there, Premier. I'm just wondering what more you can tell us about the logistics of the Phase 2 rollout. You mentioned the online and phone sign-up for people, but, are eligible people going to be contacted in some way at all? And also, where can people get vaccinated? We know Saskatchewan set up sort of a mobile or a drive-through clinic in anticipation of getting more vaccine. Is Alberta working on something similar, potentially using the field hospital at the Butterdome for something similar? Anything you can tell about logistics here?
Fantastic question. Thank you for that. The answer is it's going to depend a lot on our community partners, like our pharmacies and our family physicians, to be able to provide a lot of this vaccines, just like they do with the seasonal flu vaccine. And just a reminder that our capacity, if we had unlimited supply of the vaccine, would be no different than the seasonal flu vaccine. That would be 1 million doses of vaccine for us to be able to give out in a month here in Alberta. Now that we don't have that same supply that we get for the seasonal flu vaccine, our ability is going to still include for the community rollout, especially for folks who are going to have underlying conditions, and those who are 75 and older, and the age groups that go below that. There are opportunities in including the pharmacies and including our family physicians for them to reach out to their patient roster, because they'll know who has an underlying condition, making sure that that patient knows of the opportunity of being included in one of those priority groups. So they are going to do some of that outreach so that patients who are included will understand that they are included and have that contact from that health professional.
Thank you, Minister. Operator, can you please put through the next question?
Jason Herring, Post Media.
Hi there. First of all, for Minister Shandro, I wanted to follow up on a point Jeremy made. Are we going to see large areas like the Butterdome Field Hospital used for vaccination depots? I'm also wondering kind of more broadly, there's going to be some groups who are upset to be left out of vaccinations, teachers, police officers, among them, I can imagine. What would you say to those groups who are going to have to wait until Phase 3 most likely to get their vaccine?
Sure. Well, we are contemplating, if we ever do get a surge of a vaccine, understanding that right now, using our pharmacies, using our family physicians, using AHS, public health, to be able to get our vaccines out, would be about 180,000 vaccines in a week. But we do have an ability for surge capacity in being able to deploy rapid flow-through clinics throughout the province. And so what the locations would be and whether that would be including the Butterdome, I can't say at this time, but we have been doing that planning for those rapid flow-through clinics if and when we ever do get a surge of supply in vaccines from the federal government, so that we can ensure that we are getting the vaccines to Albertans as quickly as we get them from the federal government. I would say first, for the second question, first of all, just to point out that teachers who are in those age groups, teachers who, or firefighters or police officers or the military who have reached out to our office and let us know their concerns about being included in priority groups, first of all, those who are in those age groups and those who have an underlying condition are included in Phase 2. So those folks are included. And I got to say this, every time I speak to somebody who has wanted the ministry to and the government to very clearly outline who's included in Phase 2, first of all say to me, look, first of all, I want the vulnerable to get the vaccine. And that's exactly what we've done. We have aligned as well. What I would say to these folks is we've aligned the groups that are included in Phase 2 with the recommendations that we've received from ministry officials, as well as the Advisory Committee for Vaccines here in Alberta and the National Advisory Committee on Immunizations. And it's aligned with other jurisdictions because other jurisdictions understand, just as we do, the importance of focusing this on the most vulnerable.
Thank you. Operator, would you please put through the next question?
Jesse, Global TV. Well, hi, this question is for the Premier and the Minister, possibly. I understand there's a lot of unknowns as we receive more vaccine supply, but are you able to give an idea of the sequencing of groups for Phase 3 and 4 to help ease people's minds and mental health, even just to outline if they'll be based on age or on occupation?
Thanks. So as I said to the previous question, first of all, we have a three-stage approach here in Alberta. I anticipate a three-stage approach. I don't anticipate there being a fourth stage. Stage 2 includes about 1.8 million Albertans. So by the end of Stage 2, that will mean that we've provided an opportunity to get a vaccine to over 2 million Albertans. So by the end of Phase 2, and depending on how many vaccines are approved at that time, by the time we get to the end of Phase 2, how many vaccines were provided by the federal government, perhaps we don't need to contemplate priority groups at that time, and it can be the wider opportunity for anybody left in Alberta, but that's going to be in the hands of the federal government and the allotment tables they provide us here in the province. Premier?
So, yeah, I would just add that to kind of pick up where Tyler left off, what we're ideally, we would just, the focus is on speed of administering the vaccine. Every time we add more categories and subgroups and subcategories, what we're doing is making the process more complicated and slower moving. So I think once we get to the general population of younger, healthy people, we just want to get as many of those inoculated as quickly as we can. That's the approach that Israel has taken so successfully, where they've now vaccinated over 3/4 of their population. So they basically did it by age, obviously some serious health conditions, and they just worked their way down the age structure of their society without lots of different bespoke categories. So I think this is one of the things we want to focus on, just the most efficient, fastest administration, as opposed to setting up dozens of separate sub-queues that would just really complicate and slow it down.
Thank you, Premier. Operator, I think we have time for 3 more callers, so could you please put through the next question?
Our next question comes from Dean Bennett of the Canadian Press.
Thanks. Afternoon, Premier. I wonder if you can provide some more details on the second relaunch, economic relaunch. I know you say it's fluid right now. We're looking at numbers, and we're waiting for 3 weeks. But what does that mean? Does that mean your government will, March 1st is the end of that window, so will your cabinet decide on March 1st when to move ahead with the next one, or will it look ahead of time to have them set up as of March 1st? And can you give us more details in terms of what you're looking at for reopening? It's obviously understandably broad right now on the website, but is there any more details in terms of who will get to open up a little bit more?
Thanks, Dean. Of course, just a reminder, as you know, the step 2 in our plan, our path forward, is triggered if we get below a weekly average of 450 COVID hospitalizations, which we got below 2 weeks ago, and we've remained below. It also depends on hospitalizations continuing to decline. We seem to have kind of plateaued at about 360. We'll see where that goes, but it's well below 450. Secondly, we would only move forward with further measures to relax in the absence of significant growth of the virus. So if we were to see in the next couple of weeks a very steep, a significant increase, I should say, in new cases and the positivity rate and the rate of transmission and hospitalizations, then we would delay step 2 of the path forward. If, however, we remain more or less where we are now, or see continued decline in hospitalizations and those other numbers, then I anticipate moving forward on, as you say, in the first week of March, and we may very well make that decision a few days in advance, because we've given businesses a commitment to give them 1 week's advance notice so they can prepare for reopening. Now, in that category, you're right; they're pretty general. A general indication of which activities we'll see the restrictions relaxed, but a lot of it deals with things like conference centers and event venues for small, we would, I think, permit small gatherings within safe guidelines in those contexts. There may be some other things that I haven't yet received advice from Dr. Hinshaw on that. So will continue to monitor the situation. We may make the decision before that to make it effective 3 weeks after the step one. I hope that answered. Tyler, do you have anything to add to that? Okay.
Great, thank you. Operator, would you please put through the next question?
Our next question comes from Elise Stoll of Edmonton Journal.
Hi, thank you. Minister Shandro, when you talked earlier this week about using family doctors and pharmacists for the rollout, that was really welcome news for seniors who are concerned about transportation, both within the city and if they're in rural areas to the city. But from this announcement today, I'm unclear again. When seniors make an appointment in Phase 1B starting Wednesday, are all of these appointments being made for in a central vaccination location, or is that in a neighborhood clinic? And if that's the case, where are these centers in rural and urban areas? And if they're in urban areas, are they accessible by transit?
Well, thank you. And obviously, it's going to start with pharmacies who are ready to accept for storage and for distribution the Pfizer and Moderna vaccines, Moderna needing -20 and Pfizer needing -80. And some of our pharmacies are ready for that storage requirement. So sometimes it's going to be the interest of a pharmacy and the family physician in wanting to participate in the program. We look forward to being able to provide information once we can on which of these pharmacies are going to be stepping up to be part of the first rollout of the community distribution of the vaccines through the pharmacies and the family physicians. We do understand, though, the difficulty with our province, our geography, our demographics that we want to. That's why there's a need, including these community partners, is so that it makes it easier for our seniors to be able to get vaccinations where they're used to getting them, where they're used to getting those vaccines for the seasonal flu, so that it's something they're used to. It's something that's common for them when they're getting the seasonal flu vaccine, and that's why we know that it's important to include these community partners for the COVID vaccine as well.
Thank you. Operator, would you please put through the final question?
Our final question comes from Stephanie Rousseau of Radio-Canada.
Oui, bonjour. Ma question est pour le Premier ministre. Je voudrais savoir pourquoi est-ce que vous annoncez pas les prochaines phases de la vaccination outre la phase 2 aujourd'hui. Et puis, vous dites que la vaccination est très dépendante des doses que vous allez obtenir du fédéral. Est-ce que ça veut dire que vous attendez à des délais dans les prises de rendez-vous pour les aînés? Et combien de temps vous pensez que ça va prendre pour pouvoir obtenir un rendez-vous?
Merci de vos questions. Premièrement, le plan que nous annonçons aujourd'hui va mener vers la vaccination de 2 millions Albertains, tout compris. Alors ça, c'est presque une moitié de la population. Nous espérons, par la fin d'avril, ça dépend évidemment sur le nombre de doses que nous recevons du gouvernement fédéral. Et ça reste toujours un peu imprévisible. Ils nous ont donné dernièrement une horaire des vaccins que nous recevrons dans le mois prochain. Mais, comme vous savez, ce n'était pas exactement quelque chose de sûr auparavant. Alors, il y a toujours une certaine incertitude en ce qui concerne les sources. Et deuxièmement, nous ne savons pas quelle sorte des vaccins seront disponibles en mai, juin, juillet, dans l'été, etc. On peut obtenir les autres vaccins qui ne sont pas déjà approuvés avec les conditions différentes, peut-être limitées aux personnes plus jeunes. Alors, à cause de cette incertitude, ça ne sera pas prudent de publier un plan pour la troisième phase maintenant. Et je dirais que le truc le plus important est d'administrer les vaccins aux gens les plus vulnérables, ça veut dire les Albertains les plus âgés et ceux et celles avec les conditions de santé chroniques. Évidemment, nous mettons l'emphase sur la population autochtone à cause de leur vulnérabilité particulière au COVID-19, mais notre principe central est de prioriser les gens qui sont les plus vulnérables, ça veut dire les plus âgés. Thank you very much.
Thank you, everyone. Happy Friday.
Indeed. Happy.